So I'll start by providing you with a bit of background. So the MOST follow-up trial was a trial that was conducted that aimed to evaluate the feasibility of nurse-led follow-up for ovarian cancer via telehealth using a patient-reported outcome measure called the MOST S26 to structure consultations, and it was comparing that to routine clinic-based hospital follow-up. And so this poster is describing a trial sub-study. So this was a qualitative sub-study that we conducted as part of the broader trial, which was aiming to examine the acceptability of this form of follow-up for ovarian cancer from both the patient and as well from the nurses' perspectives who were delivering the intervention. And so we conducted interviews with women with ovarian cancer who'd participated in at least 2 of the nurse follow-up appointments, as well as with the study nurses who had actually delivered the intervention. So in terms of the results, we found kind of 3 key overarching themes. So the first one here focused on the key patient-centered benefits of this form of follow-up. So both the patients and the nurses reported that they found this form of follow-up to be really convenient, and they really appreciated the flexibility of it. In addition, they felt that it really provided a sense of feeling cared for, which was particularly facilitated by that continuity of care provided by the nurse. It also enabled personalized holistic care and prompt management of symptoms, which is really reflected in this quote here, which says, "I get to discuss the whole me. We go through everything I put on the questionnaire, whether it's worse or better, and then obviously I can voice any concerns I've got with my health." And in addition, another benefit that was noted was that it provides a dedicated space for patients to freely express their experiences and their emotions. Then the second theme we identified was focused on the challenges to the delivery of this form of follow-up from the nurse's perspective, so from the perspective of those nurses delivering the follow-up. So here the nurses talked about difficulties they had when there was a lack of clear referral pathways for troublesome symptoms. So for example, one nurse saying, "The whole referral process has been a little bit tricky because I'm not sure who I can refer to and whether that's appropriate." They also talked about the fact that it could sometimes be difficult with the telehealth because they weren't actually able to observe physical cues in the patients to inform the care that they were giving. And similarly, because of the telehealth, sometimes they found it difficult to establish a good rapport with the patient. In addition, nurses also talked about that they found it quite challenging the emotional impact that they felt when the patients then ended up experiencing a recurrence and then returned to the care of their oncologist, and the nurses no longer had those follow-up appointments with them. And they found that quite difficult to deal with, and that they didn't always know how that patient was then doing. The nurses also talked about the fact that they felt that although overall there were many benefits to this form of follow-up, they still didn't think that it would be suitable for all patients, and particularly those who were non-English speaking or who had low literacy. So for example, one nurse saying, "For some patients, telehealth really suits them, for others it doesn't. The ones it doesn't are people for whom English isn't their first language because they can't see what you're saying, they don't pick up on it quite as well." And then finally, the third theme was focused on the usefulness of MOST S26, so the patient-reported outcome measure that we used to support the consultations. And so here, the nurses reported that they found the MOST S26 really useful as a tool to guide consultations and referrals. They also found that it was useful in helping to detect early signs of recurrence, and also to track symptoms over time and flag symptoms for discussion. And patients also talked about the fact that it helped them also to reflect, actually take stock and reflect on the symptoms that they were experiencing. And so overall, this qualitative study indicated that it really confirmed the acceptability of this form of follow-up for ovarian cancer from both the patient and the nurse's perspectives. However, there were some challenges identified that would need to be addressed in the ultimate implementation of this. And that's it.